history straight from the textbook. You want to start off making sure dignity is the priority, making the patient as comfortable as possible, and maintaining that trust in the healthcare profession so she takes you seriously and you can match that with her. Start off by taking the basic history, ask her name, age and occupation, and then you want to start moving on to the general history, but how we get targeting the gynae part of it, we want to be getting onto the menstrual history, so asking questions like, when did she start her cycle? Is her cycle regular? Is the flow heavy, light or normal? And asking if there's any pain associated with the cycle. If there's pain, you want to go down the Socrates method. Asking about vaginal discharge, so onset, colour, the smell, what volume is it, and also if there's any associated itch. Moving on, we want to take note of the sexual history, so taking a good sensitive sexual history, letting her know that we're going to be asking some questions that might not seem relevant, but it's all part of how we form our diagnosis and how we form our treatment plan. You also want to ask about the cervical smear. This is massive, especially for OSCEs. It'll get you some good points with them. Moving on, you want to ask about urinary/prolapse questions, as this can come on to if the patient's having anything to do with incontinence. Coming back to the obstetric history, you want to ask about gravidity and parity, and then also the details of each pregnancy. So if they have 3 kids, ask them in order of how it went, starting from the oldest to the youngest. So we're coming forwards in time. You want to ask about the antenatal and postnatal history, if there was any complications with the child after the child was born. You want to go over the family history, and also the past medical, surgical and drug history. Along with the social history, you want to ask with smoking, recreational drugs and normal drugs. And if you're struggling at taking a history, this textbook isn't going to help you, this video is not going to help you. You need to go and take more histories. And there's a link to a PDF with all of this in my bio.